Hello, I'm Dr. Andrea Peterson.
And I'm Dr. Eric Mazer. Today's health question is, what is an observation unit? Seth?
Well,
This is Dr. Seth Sullivan joining us on the set.
Yes. Thank you. So an observation unit is a way of organizing the hospital. Norwalk does not use it currently, although we've talked about instituting one. But some hospitals will have a place where only patients who are designated as observation status, that is, patients expected to receive one night of care, relatively less intensive care, perhaps a battery of short diagnostic testing, will stay together. The idea is to enhance the patient experience by hopefully expediting testing and allowing for more rapid discharge.
Now, do you have to be in an observation unit to be designated observation care?
No observation status can be applied to any patient in the hospital depending upon the intensity of service being delivered, the expected duration of stay, the expected risks to the patient, and some other factors.
So you could be in an observation unit, or you could be under observation status in the ED, in an observation unit, or actually in a full inpatient bed.
That's right. You could be any place in the hospital and be in observation status. That's different from an observation unit, which would be a geographical place to help to house or to treat patients in an observation status.
Does observation status versus inpatient have any implication for the patient?
It does. Typically not in terms of the care that's delivered. The doctor's not going to change your care, your plan, your diagnostic testing. None of that is going to be affected by the status. This is sort of a bureaucratic requirement on the part of insurance companies and Medicare, Medicaid, to lump patients into two different categories. One is lower risk patients who require a short stay in the hospital. The other is for patients who require more intensive services.
In the observation stay, patients may have more out-of-pocket expenses.
Yes, that's
especially
correct.
under Medicare.
That's correct. Typically yes, not always.
Great. Thank you so much for that important information, Seth.
Thanks,
We really
Seth.
appreciate it.
Thank you.
If you have a health question for a doctor or for us and you'd like to suggest a topic for a future show, we would love to hear from you.
Send your questions or comments to healthtalk@wchn.org.
Thanks so much for watching, and we'll see you next time.